Hello, I'm Dr. Marshall Lucas. I am a board-certified psychiatrist. I practice medicine in the state of Texas and I'm fully licensed to do so. Here today, I'm going to tell you about electroconvulsive therapy, also known as ECT, also known as electroshock therapy. The reason it's called shock therapy is that it involves a brief amount of electrical current introduced to the brain through electrodes to generate a very brief seizure, a very medically controlled seizure. It's been noted for over 100 years that the introduction of the electrical impulse or the introduction or generation of a seizure will lead to the relief of psychiatric symptoms. ECT is a medical procedure involving anesthetic. That's what sets it apart from many of the other psychiatric treatments that we have available for us. Over the past 15 years, I have performed over 50,000 treatments with patients involving ECT, and I've found it to be very rewarding for them, and it clearly will reduce the symptoms of depression, catatonia, certain forms of thought disorder, and certain forms of delirium. We use ECT to treat specific types of mental illness, treatment-resistant depression being the most common. Symptom relief occurs after 1, 2, sometimes 6 to 8 treatments. Symptom relief for manic delirium, when a patient is excessively energetic, not sleeping, not resting to the point that they're really not with us. Those types of patients respond quite favorably and quite quickly to the ECT treatments. Another class of treatment is for psychosis or thought disorder such as hallucinations, delusions, excessive paranoia, overwhelming anxiety. Those treatments respond quite favorably to a course of ECT, anywhere from 8 to 10 treatments. Those are the general indications. ECT is not used for behavioral control. ECT is not used as a way of alleviating complex pain syndromes. ECT is used for those specific purposes. To augment that a little bit, we in the state of Texas do not allow adolescents 15 and under to receive ECT treatments. This is a treatment that's specifically for adults and older adolescents. That's mandated by the state of Texas. So we're coming up on a 100-year history of this procedure. That 100-year history is longer than many of the treatments that we offer today, indeed older than many of the psychiatric medications we have available today. We use muscle paralyzing agents and anesthetic to keep the patients asleep and comfortable throughout their procedure. We have evolved now from the 1980s to having ECT as part of our standard armamentarium because not only is it cost effective, but also with the refinements in the amount of electricity and in our treatment protocols, we're able to get much better results, and in some cases much better results than medication, in that medication will entail side effects that ECT doesn't have. When you clicked on this link to ECT associated with Woodland Springs Hospital, you were obviously looking for something. We are fully staffed and are fully licensed, and we're Joint Commissions accredited and ready to treat patients here in this specific dedicated ECT suite. ECT is used to treat treatment-resistant depression, catatonia, delirium, and hard-to-treat thought disorders. If you have any concerns in those areas, please don't hesitate to contact us. We are here to help.